Hi, today we continue to talk about temporary crowns, and in our episode we will tell you how to make temporary crown in a case that can occur quite often. The patient had a rest or was simply not attentive to dental health. As you can see in the photo, you need to do something in order to temporarily rehabilitate the patient aesthetically. In this case, we see that the crown of the tooth 2-2 is completely destroyed. The radix, which must be removed with subsequent implantation. Tooth 1-1, crown missing by half. There are no reference points and opportunities to make a silicone K. One way to make a hint of aesthetic temporary rehabilitation of the patient is to first make a model of future restoration in the mouth using a direct wax method and make temporary crowns using this template. To do this, take the usual base wax, warm it up a bit and form an approximate outline of the future restoration. We want to note that this is also one of the most budgetary methods, as even the cheapest composite is more expensive than wax, and you are not limited in time. The wax does not polymerize under the lamp and is easier to correct. While the wax is warm, it's sufficiently plastic. We can give the future restoration the necessary contours. In addition, the patient should be asked to close his teeth, so that later there are fewer corrections to the occlusal contact and will help in the formation of the oral surface. We make the final anatomy while the wax is fixed to the near teeth enough to make and get a silicone K. We shared the features of processing silicone K in a previous videos. In this case, we got a template with C-silicone without a tray, as it's quite tough. It's better to use a tray if you work with A-silicone because it's softer. Working with C-silicone in a small area, we can work without some additional tools for making a silicone K and simply compress the segment we are interested in with silicone. After that, the wax is removed. It's clear that on the teeth 1-1 and 2-2, replacement of restorations and restoration of stump of teeth is required. For this, we insert posts and use build-up core material. Of course, we will produce a separate video about how to choose post, fiberglass or titanium, but in this case we use titanium post and build-up core materials. After the stumps are restored, we start to prepare them, so that the material for temporary crown does not adhere to the stump of build-up core material. It should be well polished or insulated with petroleum jelly. In this case, the preparation margin does not descend under the gum, and it's possible to make restoration with a good fit without putting retraction cord or any additional manipulations. We prepare the silicone K, give a little thickness at the cervical line in order to get a small hypercontour, which we will then process into the normal outline of the restoration. We fill in the material for temporary crowns and position with help of near teeth and the hard palate already directly in the oral cavity. We are waiting for polymerization according to the instruction, but not complete, so that later there would be no problems with extraction. We take out and process temporary crowns. The just polymerized chemical curing composite can be safely, without fear of delamination, corrected by the light curing composite to give the desired shape. We explained the chemistry of the process in previous videos, from which is clear why the standing composite is not so easy to tie with a new one, finishing the restoration. And for a fairly short time, the patient conditionally rehabilitated aesthetically. For further long-term use, such a composite bridge is not entirely reliable, so we take impression and send them to the laboratory for the manufacture of a more reliable bridge. This can be a PPMA bridge or metal reinforced coated with plastic, in order to carry out quietly implantation in the area of tooth 2-2 and to engage in the formation of gum papilla to restore the patient's smile. Soon we will have changes in releases. Stay tuned. Wish reliable temporary crowns to all, subscribe to our channel, put likes and write comments. See you in the next episodes.